So the time in the berry house is now 20 past 11 and it's time for antiseptics and antibiotics. First, we need to talk about how us humans defend ourselves against invasion. So, in our bodies we have physical barriers that stops things getting in. So the major physical barrier, write this down, that we have in our bodies is our skin. So our skin basically prevents quite a lot of things from getting in. If the skin's broken, then we have an issue, because all kinds of little beasties can get in through broken skin. And that's why we use things like plasters and Germaline and stuff. Another physical barrier is cilia. And you can find cilia in your nose and throat. And basically, if that's the lining of the nose or the throat, they're like little hairs that stand up like this in the lining. And they beat together. So if that's a cilia, there's loads of them, and they kind of beat like that, or like that. And if you have, say you've swallowed some kind of dirt particle or a bacterium or something, in the lining of your throat, the cilia are beating like this, and they all beat together to waft any particles that you've breathed in down into the back of your throat, and then you can swallow them, and then they go to your stomach. So they just beat like that. And what this does is they're covered with mucus, so there's mucus on here, and the mucus helps trap all the little dirt and dust and bacteria particles that you breathe in, and it just wafts it all to your stomach, because in your stomach there's not a physical barrier but a chemical barrier. I'll do this here. Which is stomach acid. Which is hydrochloric acid. The pH in your stomach is about pH 2. It's really acidic, and once your cilia have wafted all the nasty little beasties to your stomach, the stomach acid then is squirted in to try and kill as much as it can. So that's pretty much it for physical barriers and chemical barriers. The next thing we need to know, it says here that we need to be able to understand that plants produce chemicals that have antibacterial effects. So we'll just write that down. Yeah, because basically if you're reading this textbook and you think that all this is loads to learn, just look in the cheat sheet, which is the learning outcomes here, and just see exactly what you need to know. As long as you know this, you'll be dead set for the exam. As long as you know it and understand it and can apply your knowledge. So, antibacterials, anti means against. So these work against bacteria, they kill bacteria. Plants have antibacterials, which help to defend them against infection. Humans can sometimes take the antibacterial properties of plants to make our own. An example of this would be witch hazel. Which is an antibacterial that we humans use, but but which comes from plants, and we use it to kill bacteria. It's in spot cream, it's in antiseptics, it's in all sorts. But that's an example of an antibacterial that a plant has that we use. So the next thing we need to know is what an antiseptic is. Septic means infection, and anti means against. So these are things that we use to kill microorganisms that can cause infection. So we need to define this. So I'm going to put that an antiseptic is a chemical substance that kills microorganisms outside the body. So an example of an antiseptic could be TCP, germaline, and things like that. So we use antiseptics to kill microorganisms outside the body. We spray them on surfaces, or we put them on cuts and things. So Dettol, iodine, which is that brown stuff that you see doctors on TV putting on people before they have operations. Chemical substances that kill microorganisms outside the body. Then we need to know about these antibiotics. So two types of antibiotics. We can have antibacterials again, to treat bacterial infections, such as food poisoning, because like we just said, if I can find it in my pile, salmonella is a bacteria that causes food poisoning. So you could perhaps use some kind of antibacterial drug to kill that. Another antibiotic could be an antifungal, and this could be used, it is used in creams to treat nasty fungal infections such as athlete's foot, which is a fungus. So that's that done. Next we need to talk about resistance, about how certain bacteria are basically superbacteria and they can develop this thing called resistance. So in the next video we're going to talk about MRSA, which is basically the name of a superbug which came about through the misuse of antibiotics. So that's the next video.